Is everyone from the applicant present who needs to be there?
Yes.
Okay, very good. I'm just going to read an introductory statement before we get started. I'm Deidre Gifford from the Office of Health Strategy. Good morning, everyone. Thank you for being here. This hearing is being convened for the limited purpose of hearing oral argument in docket number 22-32513-CON. The applicant in this matter, Norwalk Hospital, seeks to terminate inpatient psychiatric services while expanding services in the emergency department and outpatient psychiatry programs. On August 16th, 2023, the hearing officer in this matter issued a proposed final decision denying the application. On September 6, 2023, the applicant filed a brief and exceptions and requested an opportunity to present oral argument. On September 29th, 2023, the Office of Health Strategy issued a notice of oral argument for today. This hearing before the Office of Health Strategy is being held on October 18th, 2023. My name is Deidre Gifford, and I'm the Executive Director of OHS, and I will be issuing the final decision in this matter. Also present on behalf of the agency is OHS General Counsel Anthony Casagrande.
Yes.
Yes?
I don't think that was from us. Thank you.
All right, thank you. If everyone could mute their devices, please. Thank you. Public Act number 21-2, section 149, as amended by Public Act number 22-3, authorizes an agency to hold a public hearing by means of electronic equipment. In accordance with these acts, any person who participates orally in an electronic meeting shall make a good faith effort to state his or her name and title at the outset of each occasion that such person participates orally during an uninterrupted dialogue or series of questions and answers. We ask that all members of the public mute the device that they are using to access the hearing and silence any additional devices that are around them. This hearing concerns only the applicant's oral argument regarding its brief and exceptions to the proposed final decision, and it will be conducted under the provisions of Chapter 54 of the Connecticut General Statutes. The Certificate of Need process is a regulatory process, and as such, the highest level of respect will be accorded to the applicant and to our staff. Our priority is the integrity and transparency of this process. Accordingly, decorum must be maintained by all present during these proceedings. This hearing is being transcribed and recorded, and the video will also be made available on the OHS website and its YouTube account. All documents related to this hearing that have been or will be submitted to OHS are available for review through our electronic CON portal, which is accessible on the OHS CON webpage. Although this hearing is open to the public, only the applicant and its representatives and OHS and its representatives will be allowed to make comments. Accordingly, the chat feature of the Zoom has been disabled. As this hearing is being held virtually, we ask that anyone speaking, to the extent possible, enable the use of video cameras when speaking during the proceedings. In addition, anyone who is not speaking shall mute their electronic devices, including telephones, televisions, and other devices not being used to access the hearing. Lastly, as Zoom did notify you while you were entering this meeting, I wish to point out that by appearing on camera in this virtual hearing, you are consenting to being filmed. If you wish to revoke your consent, please do so at this time. However, please be advised that in such event, the hearing will be continued to a later date. So we will now proceed. Counsel for the applicant, could you please identify yourself for the record?
Sure. Benjamin Jensen from Robinson & Cole, joined by my colleagues, Lisa Boyle and Connor Duffy.
Thank you. Are there any housekeeping matters or procedural issues that we need to address before we start?
No, Executive Director Gifford, I would just add that there are also various representatives from Norwalk Hospital and New Vance Health that are present as well, virtually. including Dr. John Murphy, President and CEO of Nuvance Health, Peter Cordeau, President of Norwalk Hospital, and then other representatives from Nuvance Health and Norwalk Hospital. The only other item I would mention is that I have a PowerPoint presentation that I will share on the screen, and I should be able to open that up now.
Counsel, if I could, would you please represent for the record or verify for the record that the slideshow is only based upon matters already in the record, please?
Thank you, Attorney Casagrande. That was my next point. Yes, everything that's in the slideshow is part of the administrative record, and I do represent that, and will provide a copy to yourselves after the argument is concluded. We can also, if you prefer, upload it directly to the portal.
Very good. Thank you.
Thank you. If there are no other housekeeping matters, welcome to our colleagues from Nuvance and Norwalk Hospital, and please proceed whenever you're ready.
Thank you, Executive Director Gifford and Attorney Casagrande, and thank you for this opportunity to address with you directly the issues raised in Norwalk Hospital's brief and written exceptions to the proposed final decision in these CON proceedings. This process began over 20 months ago when Norwalk Hospital submitted its application seeking CON approval for its proposal to modernize its approach to delivering behavioral health care. Because one aspect of that proposal includes closing the inpatient psychiatric unit at Norwalk Hospital, it was necessary to apply for Certificate of Need approval from OHS. Now, as shown in the timeline up on the screen, Norwalk Hospital has fully complied with every step of the agency's CON process, including submitting completeness responses, offering testimony from its leadership and subject matter experts at a public hearing, and negotiating an agreed settlement with OHS for approval of the application. Which brings us to our current position, where that agreed settlement was rejected. Hearing Officer Novi then issued a decision recommending denial of the application, and Norwalk Hospital filed its brief and written exceptions to the findings on September 6th. Norwalk Hospital's brief raised a number of issues with the proposed final decision, including procedural objections to the manner in which the public hearing was scheduled, OHS's granting to itself of repeated extensions of time, which resulted in significant delays in this process, and OHS's negotiation and subsequent rejection of an agreed settlement allowing Norwalk to move forward with its proposal, all of which we contend prejudice Norwalk's rights and constitutes reversible error. In addition, the brief asserted written exceptions to findings of fact that were either not adequately supported by evidence in the record or were misleading or immaterial. Norwalk Hospital further proposed additional findings of fact in its brief based on unrebutted evidence in the record that the hearing officer did not consider. And if hearing officer Novi did properly consider that evidence, we contend the application must be granted. Now, in our limited time today, however, we intend to focus on Norwalk's substantive objections to the proposed decision's conclusions and demonstrating to you, Executive Director Gifford, that when the evidence is properly considered and the preponderance of the evidence standard is fairly applied, Norwalk Hospital has met its burden of proving this application should be granted. To be direct, denying this application is the wrong decision. Requiring Norwalk Hospital to continue operating an underutilized and understaffed inpatient behavioral health unit in a saturated service area is the wrong decision. Mandating that Norwalk incur a massive capital expenditure of $18 million to modernize that underutilized facility just to maintain that status quo it is already determined to be inadequate is the wrong decision. And forcing Norwalk to maintain this facility at the expense of improvements to its emergency department that would respond to an ongoing public health crisis is the wrong decision. So why is it the wrong decision? Well, because it's directly counter to OHS's mission and the entire purpose of these CON proceedings. On your screen, you'll see a direct excerpt from the CON guidebook made available by OHS, This process is meant to elicit information regarding three primary areas: public need, access to care, and cost effectiveness of healthcare delivery in the region. And the program strives to minimize unnecessary duplication of services, facilitate healthcare market stability, and contain costs. So why is that important? Because duplication and excess capacity increases healthcare costs for consumers and in turn the state. Norwalk Hospital's evidence in support of this application was laser focused on these crucially important considerations. But the proposed final decision, if accepted by you, Executive Director Gifford, will not respond to public need. It will undermine it. It will not improve access to care. Even the hearing officer recognized in the proposed final decision that access to care already exists. It will not limit duplication of services. The proposed final decision mandates duplication. And finally, it would threaten the financial sustainability of the healthcare market, not stabilize it. Now, taking a step back, prior to initiating these proceedings, Norwalk Hospital completed a comprehensive evaluation of its delivery of behavioral healthcare services. What it determined is that its historical approach of managing crises in its emergency department, offering inpatient level of care for its highest acuity psychiatric patients, and relying on community providers to furnish outpatient services was insufficient to meet the evolving standard of care. Now, at the public hearing, the hospital's leadership and subject matter experts explained why. Emergency departments are overwhelmed with behavioral health patients in crisis. Patients end up in inpatient units due to a lack of safe discharge options to return to their communities. And there is a lack of outpatient providers that will see patients that are unable to pay out of pocket. Now, the conclusions that were drawn from Norwalk Hospital's analysis is that the status quo is inefficient, clinically suboptimal, high cost, places an undue strain on patients and their families, and fails to provide adequate access to care in the community. Norwalk Hospital seeks to address these problems head on by expanding outpatient programs in the community, including through establishment of intensive outpatient programs. These programs allow Norwalk to target particular community needs, including treating adults with dual diagnoses and adolescents needing mental health treatment. Additionally, Norwalk intends to enhance its emergency department to better allow it to stabilize and treat behavioral health patients in crisis. Now, this includes having dedicated space for behavioral health patients in the emergency departments and additional treatment bays for children and adolescents in crisis. Last, Norwalk proposes to consolidate its inpatient services with Danbury Hospital at a to-be renovated, modernized, and expanded inpatient psychiatric facility. Returning to the three pillars identified by OHS in its CON guidebook of public need, access to care, and cost effectiveness, Norwalk's application addresses each and fully aligns with OHS's mission. First, public need. The statewide plan, federal guidelines, and the testimony from Norwalk's subject matter experts all made clear there is a critical need for outpatient treatment options in the community. The hearing officer recognized this need in the proposed decision. And relatedly, better equipping emergency departments to be able to stabilize, diagnose, and safely discharge patients back into the community is also an area of compelling public need. Conversely, there is less public need for inpatient psychiatric treatment, particularly given the fact that there are 7 other providers within 25 miles of Norwalk Hospital already offering inpatient psychiatric units. Next, access to care. There is no question that the proposal by Norwalk Hospital increases access to outpatient care, and that patients continue to have remarkable access to inpatient care based on the sheer number of providers in the immediate area. Last, cost effectiveness. Outpatient treatment of behavioral health conditions is more cost effective than inpatient, particularly when you consider the value of early intervention, which can prevent the need for costly inpatient care. The evidence at the hearing made clear that if this application is denied, Norwalk Hospital is facing a massive capital expenditure of $18 million to modernize its inpatient facility just to maintain the status quo of operating an underutilized and understaffed unit. And as we will discuss, the hearing officer agreed with Norwalk Hospital that the proposal is cost-effective and effectively utilizes existing facilities that have excess capacity in the area. So if the statutory criteria are so clearly met by Norwalk Hospital's application, how did the hearing officer reach the conclusion to deny the application? Several ways. First, the hearing officer declined to consider the full scope of Norwalk's application. Despite much of the CON proceeding and public hearing being focused on the expansion of outpatient services and improvements to the emergency department that I've already described, in the proposed decision, the hearing officer selectively decided that only inpatient behavioral health treatment was relevant. Omitting aspects of the proposal from the proposed decision's analysis is clear error. Next, breaking with prior OHS decisions, the hearing officer in the proposed decision decided that several of the statutory criteria were simply inapplicable to termination proceedings. There is no support in the statutory language for that approach. Had the hearing officer properly considered issues like clear public need, proposed payer mix, and the need for services among the identified population, each criterion would have supported granting the application. The hearing officer also interpreted the statutory criteria to impose standards that no termination application could possibly meet. Most glaringly, the proposed decision found that a reduction in inpatient providers within a 20-mile radius from 7 to 6 necessarily meant that there was a reduction in patient choice and diversity of providers, and that the statutory criterion was not met. Under that standard, to be clear, no termination application can ever meet the criteria that's been established by the hearing officer in the proposed decision. Last, in applying the statutory criteria, the hearing officer made no effort to weigh the evidence. If there was even a finding of a hypothetical reduction in access, however minimal, the analysis by the hearing officer stopped there, with no comparison of that reduction against the benefits of the proposal in terms of expanded outpatient offerings, improvements to the emergency department, and the massive cost efficiencies that would be gained by going forward with the proposal. Now, turning to specifics. In reading the proposed decision, you will find that the significant weight of the findings actually support granting the application. For example, the hearing officer agreed with Norwalk Hospital and concluded that there is, in fact, a compelling public need for outpatient behavioral health care services in the area. The proposed decision agreed that the project is financially feasible. The hearing officer agreed that the proposal is cost effective and will improve the cost effectiveness of healthcare delivery in the region, particularly for Medicaid recipients and indigent persons. The hearing officer also agreed that the proposal effectively utilizes existing facilities in the area and avoids unnecessary duplication of services. These findings by the hearing officer in the proposed final decision are all 100% consistent with the purpose of the CON process and OHS's mission, and all support granting Norwalk's application. But we're here challenging a denial. So there are obviously findings by the hearing officer that do not support granting the application. What are those? Reviewing the proposed final decision in detail reveals a total of 4 adverse findings by the hearing officer that were used to justify denying the application. First, the proposed decision finds that patients would need to leave the community of Norwalk in order to obtain inpatient care. Second, if approved, instead of 7 providers of inpatient psychiatric services within a 20-mile radius, there would be 6, which is less than 7. Third, patients electing not to treat at Danbury Hospital would have to travel to alternate providers and therefore could be responsible for the cost of their own transportation. Fourth, the hearing officer concluded that the proposal is not driven by a wish on Norwalk Hospital's part or Nuvance Health's part to provide quality inpatient care in the community. Now I'll address each adverse finding in turn. Starting with the concern that patients in Norwalk will need to leave Norwalk in order to obtain inpatient psychiatric care. This is a wholly novel standard, as access to care has never been determined based on municipal boundaries. And before addressing why this is the wrong standard, it's important to recognize just how significant this finding is to the overall proposed final decision. Now, in total, the hearing officer found that 7 of the statutory criteria in section 19A, 639A were applicable to this termination proceeding. Of those 7 criteria, she found that Norwalk failed to satisfy 4. Of those 4 criteria, the hearing officer found Norwalk failed to satisfy, 3 were based on this finding that people in Norwalk would have to leave Norwalk to obtain inpatient psychiatric care. Subsection 2 of the statute looks at the relationship of the statewide plan. Here, the hearing officer found that closure of the inpatient unit will force community members in need of inpatient services to leave the community. This is limited only to individuals living in Norwalk would have to leave the city lines of Norwalk to obtain inpatient care. Next, subsection 5, which assesses the impact of accessibility of healthcare delivery in the region. Here, the hearing officer found that the applicant's proposal will make inpatient care more difficult to access in the Norwalk community since it was the only unit of its kind in Norwalk. Next, subsection 10, which looks to whether there has been a reduction in access to services by Medicaid recipients or indigent persons, and if so, if a good cause exists for such reduced access. Here, the hearing officer found that if Norwalk is allowed to terminate inpatient services, patients would need to leave Norwalk and go to one of the surrounding towns for these services. Now, this standard, which seems to suggest that every municipality has to offer a full suite of healthcare services to its residents to ensure access to services, is flatly inconsistent with the state of Connecticut's approach, which has been to emphasize the importance of a regional approach to delivery of healthcare in order to limit duplication and reduce costs. This approach is demonstrated through the very language that appears in the statute. This is 19A 639A up on the screen. Now, throughout the statutory criteria, the guidelines and principles which are identified in this statute, there is references to the state, to the region, and to the service area. Nowhere in this statement of guidelines and principles, the legislature directed OHS to consider and make written findings concerning, is there a reference to a town, a municipality, or a city line or boundary? Now, as this statutory language demonstrates, municipal boundaries have never been used as the baseline for determining access to care, and the hearing officer's decision to create this standard should not be endorsed by OHS. The second finding was that there would be, in the proposed decision, that the proposal would negatively impact patient choice and diversity of providers in the geographic region, and that's subsection 11 under the statute. Here, the hearing officer concluded that there would be a negative impact since there are currently 7 providers within a 20-mile radius, as shown on the table to the left, which was taken directly from the proposed decision. And if the application was granted and Norwalk Hospital was permitted to close its inpatient unit, there would then be 6 providers. It is impossible to square the hearing officer's conclusions that the application effectively utilizes existing available resources and avoids duplication of services with her corollary conclusion that the proposal improperly reduces patient choice and diversity of providers. The fact is, patients in the Norwalk area requiring inpatient care have a remarkable range of options in the immediate area. This is not a proposed reduction in providers from 1 to 0 in the region, or even 2 to 1. This is a reduction from 7 providers within 20 miles to 6. And that doesn't even include Danbury Hospital, located just over 20 miles from Norwalk. Now, if that modest of a reduction in a saturated market can fail this statutory criterion, it's clear that no termination application can ever meet the standard. Because interpreting the standard in a manner that no applicant can meet would be contrary to the legislature's intent, OHS must make findings that the reduction in available providers from 7 to 6 has a material negative impact on patient choice and diversity of providers. It is manifestly insufficient to simply say 6 is less than 7 and end the analysis there. Now, because there is no evidence in the record that closing Norwalk Hospital's inpatient unit would have that material negative impact on patient choice or diversity of providers in the geographic region, this statutory criterion should be deemed met by the application. The third adverse finding from the hearing officer placed significant weight on hypothetical costs that patients might incur for transportation if they decided to treat at a different facility instead of Danbury Hospital. Now, this finding was used to support the hearing officer's conclusions that 2 statutory criteria were not met. Now, as an initial matter, there is no evidence supporting this finding in the record. The citation to the record by the proposed decision, which was finding of fact number 16, says nothing about patients paying for their own transportation. The proposed decision also makes no effort to assess the materiality of the likelihood of such transportation issues arising. Now, the unrebutted testimony at the hearing made clear that Norwalk Hospital is not putting patients requiring inpatient psychiatric admission onto public transportation or back into their cars. They would be transferred by ambulance. Even if this were a valid finding, even if there was evidence in the record to support it and that it was a material issue, this is an issue that was already considered and addressed by Norwalk Hospital. As OHS is aware, Norwalk agreed in its settlement with OHS that it would not charge patients any amounts for transportation to Danbury or any other hospital within 25 miles for 3 years. Norwalk Hospital is prepared to stand by that commitment, and this is simply not a valid basis to find that 2 of the statutory criteria are not met by the application. Last, Norwalk Hospital takes significant issue with the proposed decision's determination that quality of care would be diminished as a result of the granting of the application. This statutory criterion, which is subsection 5, requires OHS to consider and make written findings concerning the impact of the proposal on the quality of healthcare delivery in the region. The sole factual finding supporting this conclusion in the proposed decision was testimony from Dr. John Murphy, President and CEO of New Vance Health, about why the proposal was cost effective. And the hearing officer took these statements out of context and ignored all of Dr. Murphy's and other witnesses' testimony about quality of care in order to reach the determination that applicant's proposal is driven more by staffing issues and a wish to only renovate a single unit than a wish to provide quality inpatient care in the community. Respectfully, speculating about the applicant's true motivations is not a finding about the impact on quality. The proposed decision cites no evidence about a negative impact on quality for inpatient psychiatric services from the proposed consolidation with Danbury Hospital. The applicant presented significant evidence demonstrating that the proposal is designed to meet the evolving needs of the community, which prioritizes outpatient care for discrete patient populations such as adolescents and the ability to effectively and safely treat patients presenting to the emergency departments in crisis. All of that evidence was ignored in favor of impugning the applicant's intentions. That is an abject failure to fairly apply the statutory criteria and is reversible error. Now, it's important to take a step back and think about what the effect is of denying this application. What is gained? Who is benefited? Denying this application benefits nobody. The community backs this proposal, and it is supported by political leaders in the community and the federal government. No individuals or entities intervened in these CON proceedings, and only 2 members of the public even appeared to offer public comment at the hearing. Against this lack of any discernible benefits, consider the costs. OHS's proposed denial would force Norwalk Hospital to incur an $18 million capital expenditure to modernize its inpatient unit just so that it can maintain a status quo that it is already determined to be inadequate. Now, once all those funds are committed, the unit will face the same challenges as today with underutilization of the service and difficulty staffing. Beyond the harm to Norwalk Hospital itself, consider the harm to the community, as this proposed decision will make it so much more difficult for Norwalk Hospital to evolve to meet the behavioral health care needs of that community. Now, I've gone through today all the reasons why the findings and conclusions in the proposed decision are flawed and incorrect factually and legally, and will be subject to reversal by the Superior Court if necessary. What I hope to leave you with today is that there is no way to write a final decision in this matter that fairly applies the statutory criteria consistent with OHS's mission and that results in a denial of the application. That is simply because the overwhelming weight of the evidence demonstrates that granting this application is the right decision. Last, if there are ways that this proposal can be modified so as to better serve the community and align with OHS goals, Norwalk Hospital remains ready and willing to work with OHS to achieve those ends. On behalf of Norwalk Hospital, I want to thank you again, Executive Director Gifford, and the entire OHS staff for your consideration of this application, and I welcome any questions about this argument or our brief generally. Thank you.
Thank you very much, Attorney. Is it Jensen? Do I have your name correct?
Yes, it is, Jensen.
Yeah, thank you very much for that very complete presentation and for the brief. I don't have any follow-up questions. Your presentation was very clear, and I understand and acknowledge the information that you've presented. I will go ahead and issue a final decision in accordance with Chapter 54. I want to assure the parties that I and OHS will carefully consider the material that you have presented this morning and the material in your brief. We appreciate it. We appreciate the engagement. And I think that concludes our proceedings for the morning, unless there are any other issues.
Nothing further from me.
I would like to ask if anyone would like to order the transcript, Mr. Jensen.
Yes, please.
Okay, and Mr. Casagrande?
Not at this point. Thank you.
Okay, you're welcome. Thank you, everyone. That's all I have.
Thank you, Ms. Blakesley. So that concludes our proceedings for the morning. Thank you very much, everyone, for your participation.
Thank you.
Thank you.
Bye.